All right. That being said, let's head over to the KUAM News Zoom room where we just had all those small business owners. They sprayed all the stuff. They did the blue light, disinfectant, Clorox wipes. The Zoom room has been adequately sanitized, but we'll just leave it to Pat of Public Health to just double check. Pat, I know you might not be in like the infectious disease division, but I'm pretty sure you know something about something with. And so let's get here on Bree. We have the Guam Diabetes Control Coalition. Of course, our buddy Patrick Lucis from the Department of Public Health and Social Services. He's joined by Agnes White, registered nurse, certified diabetes educator, and vice chairperson of the Guam Diabetes Control Coalition, and registered nurse Glynis Almonte, who is the secretary of the Guam Diabetes Association. So good morning, everyone.
Good morning. Happy day.
Pat, I just got to say, looking at you, you remind me of the Liberation Day parade and the drumming that I know. Is it the, I want to say the Aklan, I hope I got it right. Is it the Aklan Association?
Yeah, the Aklan Association doing the Atitihan. We miss it this year.
Right, yeah, there's no parade, but you guys have always got the drumming going on and the yellow and the black, and it's like, yeah. There was a time when we had a parade and there was like, you could have a carnival and you could have a gathering and there was anyway. So we got you guys on here because we keep hearing from all the doctors and the medical people that one of the most at-risk groups when it comes to the coronavirus are people with diabetes. And so we wanted to kind of get you guys on to talk about that and maybe address the diabetics out here on what they need to do and how they can continue to receive the care they need during the lockdown and keep themselves safe from the virus. So good morning.
All right, good morning. So first of all, I just wanted to say I'm Patrick Lucis. I am the program coordinator at the Diabetes Prevention and Control Program at the Department of Public Health and Social Services. And I'm here in support with I'm here with our Guam Diabetes Control Coalition. So that is going to be our topic for this morning. I do want to thank you for the opportunity. I do want to mention that the mission of this Guam Diabetes Control Coalition is the mission of the Diabetes Coalition is to reduce diabetes incidence and mortality on Guam through collaboration of public and private stakeholders. And this will be done with respect, collaboration, innovation, impact, and commitment and trust. So the coalition has been around since 2008, and we've been doing a lot of work behind the scenes. So there are some activities that we're trying to do, that we're doing now despite this COVID work. We're working, as you can see, many of our members are working out of home, but doing the hard work to try to reduce and prevent diabetes. So just to give you some stats on diabetes globally, there is about 425 million diabetes throughout the world, and that's expected to go up to 629 million in 2045. In the Western Pacific, we have the highest diabetes globally at 159 million, and that is estimated to go up to 183 million by the year 2045. Just to give you some stats here on Guam, our top leading causes of death as of 2016, our number one leading cause of death is cardiovascular disease. Cancer is number 2. Pulmonary disease is number 3, and that is disease that has to do with infection of the lung, which could be due to smoking or breathing secondhand smoke, that kind of thing. Number 4 is diabetes, followed by number 5, which is cerebrovascular disease, that is stroke. And then we have sepsis, renal disease, suicide, other accidents, and liver disease. So the reason why we bring that up is because we know that having diabetes has a lot to do with what's happening now with COVID. And so our team here is really going to talk about what is it that we can do to prevent and control diabetes. Just a few more stats here. We know that in our renal care, 75% have dialysis. 75% on dialysis have NCDs or diabetes. And then what do you call that? The youngest person with blindness with diabetes here in Guam is about 16 years old, and the youngest with diabetes is 5 years old. So we do have alarming numbers, and these are why these are the reason why the Guam Diabetes Coalition is coming together to try to address these issues. So I'm going to go ahead and have our members introduce themselves and talk about what they need to talk about.
Okay, before we get into that, Pat, I just got to break in here with some breaking news as the island has recorded its 38th COVID-19 related fatality. The information coming from the Joint Information Center, they were notified that Guam's 38th COVID-19 related fatality occurred at the Guam Memorial Hospital this morning, approximately 6:55 a.m. The patient was a 76-year-old female with underlying health conditions that were compounded by COVID-19. She was transferred to GMH on September 18th after testing positive for SARS-CoV-2 at the Guam Regional Medical City. As the dawn broke and many of us were starting our day, we lost our 38th individual to COVID-19. As an island still mourning, her passing is a great loss to our community. To those she cherished, Jeff, Lieutenant Governor Josh, and I send our condolences, and our collective hearts are heavy with sympathy. That statement from Governor Lulian Guerrero. Sorry, I didn't mean, I just had to cut in and get that breaking news out. And so if we could, guys, let's move ahead in the conversation and talk about the PCOR 1 lockdown and maybe some of the challenges diabetics have had in getting the care they need, everything from like routine stuff to, procedures or things that might have popped up during this lockdown. And how can they best protect themselves against the spread of the virus? Because we just talked to Lillian a lot, and they've got a whole ward they're trying to build or to outfit in GMH where they can put dialysis machines next to ventilators, right? Because they're saying that the influx of COVID patients with diabetes, it's something that they're struggling with. So we'll go ahead and give you the floor, Glynis and Agnes.
Yes, the COVID-19 has really affected our island. And like you said, comorbidities are the big factor in the fatality for our patients who have passed away. And it's always the comorbidities like you have diabetes, you have high blood pressure, you have chronic kidney disease. Those three are like, they're triplets. In one person, we see that all the time. And I think one reason why we have patients coming into the hospital very, very sick, DOA, dead on arrival, is because some of them, they're not able to take care of themselves well while at home. And also they are fearful of going to their doctors, going to the hospital. And so when they're very, very sick, that's when they will decide to go to the hospital and to their doctors. So that's really very sad what's happening in our community. And so Aggie, who is our certified diabetes, will probably talk about some of the things that the people with diabetes, not only with diabetes, chronic kidney diseases, can do while at home with their families supporting them.
Hi, good morning. Thank you for having me here. I was just really struck by the conversation you had earlier with the Action Pack group and what Gina Campus has to say. And I just want to tie in something here with diabetes, what Gina Campus has to say. We have been given such fear instilled in our hearts, so many messages. Stay home, wear your mask, you might get COVID, we don't have enough room. So much fear that people are really paralyzed. And that's my biggest beef. These guys will know that. Why so much fear? They have to be hearing a message of take care of yourself. This is how you do it. This is how you boost your immune system. So in the event that you might have COVID, which is going to be with us, I don't think it's going to be totally eradicated. And I don't know what our government leaders are hoping to say. They want to see numbers go down, but to zero, I'm sorry, that's not going to happen. So we need to get the message out that you have to stay healthy, and this is how you stay healthy. We're not hearing that message consistently, and that's a message we should hear consistently, along with wearing your mask and be 6 feet away from each other. Be healthy, and this is the way you do it. And that's why we're here, to help people do that. And I hope this is a message that you guys at KUAM will consistently give to people. It gives them hope. Right. And one of the ways that you can stay healthy, for crying out loud, is to exercise. But then we have, you can't even go to the public beaches and exercise. I mean, that was early on, just totally ridiculous. And that really threw me. I mean, that really got my blood. Really did. Exercise is one of the best ways you can stay healthy. Another way that you can stay healthy is if you smoke, stop smoking. Now is the time. It's even more imperative that you have to stop smoking. And there are programs out there to quit smoking. I know GRMC has a program, and Pat, you might address that they have something online, or the call line as well. So, stop smoking. If you have to lose weight, then you got to do it. It's imperative. You got to stay healthy. Eat more healthy. And I know these days that's very difficult. The incidence of food insecurity, and food insecurity is termed as people who really have having difficulty really getting food to your homes, and not enough money to even buy this food. And so you're at the mercy of a lot of these food pantries who don't, they get donations, and God bless them for at least trying to give something to people who need it. And I did help pack some food stuff for one of the organizations. And it's not the healthiest thing. So it's even hard to talk to people about healthy eating, which is one of the pillars of managing your diabetes.
Right.
When just getting food isn't. So it's
Right.
it's really difficult.
When you say, exercise, stay healthy, I mean, first we couldn't go to the beach and exercise. Now we can go to the beach. You got to go exercise alone. I'm the type of person, I don't feel safe, going out and exercising alone. I just can't do that because, of crime. And so what are ways that people can exercise, I guess? Just at home.
Within your own home, there's a lot of, even online, you exercise with a video. You just move. You just have to move more. Since we're, relegated to our homes, and we're supposed to be, quarantined at home and stay home. Well, we can be moving at home. We can be doing, just
Zumba.
walking back and forth, or jogging your place, or when you're sitting down in front of your computer, if you have, don't sit, maybe you can stand and march in place. That's what I do. If you don't have weights, you can be lifting, 2-pound cans of beans, while you're doing your Zoom meeting.
Right.
Something you got to just keep on.
How many
moving.
pounds is a 12-pack?
I don't know.
Right.
I don't drink.
Agnes, you brought up some really good points when you talked about the messaging, right? And you're right. I mean, for the last how many months,
the message is just fear.
Right. No, and I think that you're right. We should have made more room for other messages instead of stay home, wash your hands. I agree. We should have told people to take care of yourselves, because it's I believe it's cost us lives. Because we told people to stay home, and people, you're right, they didn't want to go to the clinic because of the COVID. Some clinics were COVID-19 clinics. And then what do we end up? It's still happening. It's still happening today. We get these releases from JIC where so-and-so showed up at the hospital, tested positive for COVID, had respiratory problems. 5 days later, they're dead. We heard from Lillian Pasanas that, you're right. People are waiting too long. They're waiting too long to go to the emergency room. They're waiting too long to get their checkups. They're just waiting too long.
They're so fearful. We had a meeting, and the territorial epidemiologist said that about a third of the deaths have the underlying condition was diabetes.
Right.
Yeah. So
that's why they're fearful.
Sure right. So, that's the underlying condition. Now, when you have to take care of your diabetes, when you have to self-manage, you're going to have to, you only see your doctor every 3 months, if you can afford it. And if you're lucky, and you see them for 10, 15 minutes. But the other, how many minutes left, you're in charge of taking care of your own health. And I just want to emphasize that to people. You are the expert in your own health. Take a hold of that. Take responsibility for that. Make that your own. And there's hope. You don't have to, just because you have diabetes doesn't mean you can't live a really full life. You can. The problem with diabetes is having your sugars out of control. Once you can manage your sugars, well, you know what? You're good to go. My father was 93 when he died, and he had diabetes for almost 50 years. So, and he led a very healthy life until those last, couple years.
Right.
But for sure, we have to give out messages of hope. And to manage your diabetes, there's some self-care behaviors that you have to have, like you have to be able to eat healthy, be active. And one of those things that is hardly ever addressed is healthy coping. And in this day and age, what more is imperative than to be having tools to have healthy coping? And how can we do that when our churches are closed and many people rely on that? For crying out loud, our churches are so, disinfecting everything. You get your temperature checked before you go there. Every other pew is roped off. They're spread out so far. Afterwards, people are spraying down the chairs, the pews. It's crazy. And healthy coping is imperative to battle diabetes. I can't talk to you about eating healthy, about taking your meds, about complications, unless mentally and emotionally you're ready for that. Now, if you're depressed and if you feel isolated and if there's a perceived threat and you have some symptoms of like post-traumatic stress syndrome, as well as depression and anxieties, we can't even talk about managing your diabetes unless that's addressed. And many of the tools that people need to handle their stress and cope healthily are taken away. So, I mean, I'm just very, very frustrated as well.
I like
That's
it
why I
though.
go run.
You should have texted me. I would have
I
brought you on
know.
earlier. And we kind of got to really move along. But and again, what you're talking about, the fear, right, Agnes? I understand the messaging, but I think it's a real fear, especially when we hear from all of the frontliners that people with diabetes are going to be dying from COVID. They're going to be hit the hardest from the COVID, right? So
Well, so why don't,
right. And so,
So
how do
why
we
don't we
how do we
spend-
prevent that? What do you want to say to the diabetics out there, the people with the advanced kidney conditions, in terms of
I want to say, I want to say, folks, you can handle this. You can take a hold of your diabetes and you can manage it well. And let us help you manage it well. But you know what? No one's saying let's help you manage it well. Do we have a hotline for people with diabetes? No, we have a hotline to 311. We have other hotlines, but we don't have hotlines for people with chronic illnesses. We need something like that, and people to man it, and it'll give people hope. You can do this. Let's do. What do you have to eat? Let's see. Maybe we can prepare that better.
Right.
I'm not going to say go out and get fruits and vegetables, which is you have to eat. You need more fresh stuff. If you don't even have money to buy it, what can I say? But so let's work with what you have.
Right.
So you need to give people that sense of hope that they can do this with what they have now.
good point?
So we have to really,
Yeah. Chris,
So many people
Sabrina,
Glynis, I just want to say, so many people are so closely affected by diabetes. Like Sabrina, I mean, both her parents have diabetes, and I think on this island, we all know somebody. I mean, my grandmother died of it. It runs in my family, and this is like the big bullet that I feel is a chamorro I really got to dodge. But we try and manage not just the care of ourselves, but the care of our loved ones. And so, in talking about this, it's hard for someone like Sabrina who's living with parents or has parents who have diabetes. So, Bree, what goes through your mind when you hear this?
yes.
And
If I may add, can I go in?
yes,
Or
please.
Sabrina?
No, no,
Yeah,
no.
if I may
go ahead.
add to what Aggie said about coping, there is a crisis hotline, Guam Behavioral Health and Wellness. So they're open 24/7. So people, if they are getting lonely, depressed, they can call that number. And with regards to diabetes information, the Guam Regional Medical City, the Education Department, has agreed to receive calls if they want to get information about diabetes. So here's the number, 645-5688, 645-5688. But of course, that's during daytime only, 8 to 5. But you can always call their number, and our our educators will be able to assist in providing information about diabetes and other chronic diseases.
And then for more resources, you can also visit either the dphss.guam.gov website. We also have the CDC, Centers for Disease Control diabetes site. And then there's just Aggie mentioned about stop smoking. The department still has the 1-800 quit now, so you can either go through there, or we do have some people at Guam Behavioral that may be able to assist you with that. And also GRMC's Patient Education Center, they also have a tobacco cessation program as well.
Glynis, any final comment?
Yes, if I may add, what the Guam Diabetes Control Coalition has done and is doing is in July and August this year, we started to send surveys to the village mayors of Guam and to ask to learn more about their community needs related to diabetes and or chronic kidney disease, other chronic conditions. So to help address the gaps in access to care, or to build the knowledge and capacity of their community and address these chronic illnesses. So the number one, as expected, as the most common in all the villages, is diabetes, pre-diabetes and diabetes, followed by hypertension or high blood pressure, and then heart disease. And there are stroke, obesity, chronic kidney disease, cancer. So that's their ranking. And what are the barriers? We asked them also what are the barriers that prevent their community members from participating in their programs. Lack of insurance or finances. Transportation came in second, and lack of knowledge of the services in their community. And we asked them also what activities or programs will help promote wellness, disease prevention, and disease self-management in their villages. And outreaches came number one. So that's what we plan to do when this pandemic will subside. We're able to go out, screening, diabetic classes. But for now, with the COVID, so we plan on doing things virtually, and what we're doing right now. And hopefully that will help out our community. Thank you.
Thank you guys for coming on the show, and we'll try and make this more frequent where you guys can come on.
Right. Agnes, we want to put our money where our mouth is. We talk about needing a diabetes hotline. Let us be that hotline.
Okay, can I just add one more thing? Like, if you can spin a message of hope and less fear. I mean, we take precautions, absolutely, but there's a message of hope. Just managing your diabetes, you can do that, or managing your high blood pressure. People can do that, and there's ways to do it, and there's people who can help you do that. Please share that with them. And then back to the emotional and the ability to cope well with all that's happening and how it ties into diabetes self-management. It's important that we allow people to say that it's okay not to feel okay. I feel like I'm discombobulated by all of this, and that's what I tell people too. But we have to allow people to express that and validate that feeling. That way it's real, because the effects of COVID, even after it's gone and things settle down, will still continue. People will still be emotionally affected by this after the virus hopefully goes away, or when we get a vaccine. The feelings of anxiety, of like perceived threat, will still have to be addressed. And so it's important that we, like I said, we need to address people's emotional health right now before we can even talk about this is how you do healthy eating. This is how you give your medications. This is how you take it. And these are the kind of medications you should be taking. And these are the side effects. That's all part of managing your diabetes medications, as well as problem solving and checking your blood sugars, which is very important. So if we can have a series, just little tidbits of how to just practical steps and how to just manage, perhaps that might be a little something we can
Yeah,
do.
let's
to
do it.
understand.
Agnes, I'll get a hold of you. We'll do it every week. We'll get you on and you do a bunch of tips.
Sounds
Okay.
good.
Yeah, and Glynis, you have my
I'm
number.
all for that.
Yes,
Right on.
Sabrina.
Patrick,
Thank
bring
you.
your drum. We need drumming. We need more drumming. It's good mental. It's good for the
Keep the
mental.
beat going.
Right.
Get some physical activity.
Right on. Yeah, banging that drum. That's
Yeah,
hard work.
Exactly.
Thank you.
Take
We'll do
care.
that.
Okay, Esther.
Thank you, Chris. Thank you,
Okay, Joss.
Sabrina.
Right on.
Thank you, Chris, Sabrina. Thank you, everyone.
Thank you.
Bye.
Okay, we
Bye-bye.
need just a real quick. We got to wipe down everything in the K-Wave News Zoom room. There are fast wipers in there, little sanitizing duendes. I always get a visual of a little duende.
Did you just snort?
I just snorted. Yeah, anyway, so I had a visual of little duendes spraying and